Andrea, if you want to introduce your staff and put yourself on record, we will you run through. Thank you. This is the document. Yes, that walks us through what is behind the request.
Great. Yes. Happy to do that. You know when you're ready.
We are ready. Oh, I think. Does Andy have a copy? Okay. All right. Now I guess we're ready.
Okay, great. Well, Madam Chairman, members of the committee, thanks for having us today. For the record, Andrea Delevrier, I am the Commissioner for the Department of Vermont Health Access, and joining me today is Patrick Rooney, CFO for DEVA. So we're happy to be here and share the budget adjustment for FY23 with you. And essentially our request is $101.3 million in new appropriations, similar to the last session. One of the key drivers for this request is the increased Medicaid caseload and utilization due to the continuous enrollment requirement throughout the public health emergency for health insurance. So with that, if there aren't any questions, I'd like to turn it over to Patrick for a walkthrough of the ups, downs, and the narrative. We can answer questions as we go along.
Okay, so there's a lot of moving pieces. It's a lot of money. And we have assumed that that you would be doing eligibility redeterminations by now. So I don't know what has staff been doing if they haven't had to do redeterminations.
You would be surprised.
Planning
For the unwind of those.
So yes, there's some big movements here because of caseload and utilization as well. So why don't we run through this document? Of course, then the other thing is you get more quarters of higher federal match, which is helpful. So, okay, great.
Okay, so do we have everybody?
I think you want to put it up, or we've got it right here. Committee preference for Bobby. The problem is you can't, for anybody on that side, the screen is worthless, so they're going to be working on this document. So,
Okay.
but I suppose anyone who's watching may want to have the advantage of looking at the document, so we'll keep it up.
No, I'm not. I'm not gonna get on it.
So the first one is transitional housing complex care management.
Yes, so let me, for the record, say my name, Patrick Rooney. I'm the head of finance for Department of Vermont Health Access.
And how long have you been in the position?
Since April of last year. And is everyone familiar with the ups downs document so far and how this works? Comfortable with that?
I think so.
Okay.
I'm laughing because it was something that I did back when I was Commissioner of the Department of Social Welfare, when there was one. And so it was the best way of, when you had a lot of movement within an appropriation. So I guess I would say I'm quite familiar with it.
Okay.
But we have 2 new members to the committee, and it might be helpful. It's just a way of and how do you get to the bottom line? Because you've got certain areas where you might have more spending, less spending, and how does it all get to total up to the request that's being made of us. So maybe we should go around, since we have new faces on the committee, and introduce ourselves as well. And, do you want to start, Bobby?
Yeah, Senator Starr, Bobby Starr from Orleans County.
Ginny Lyons, Senator from Chittenden Southeast.
Rich Weston, Senator from
Jane Kitchell, Senator from Caledonia. And Senator Sears is normally in this chair. He's coming up from Bennington. He'll be here later today. He really does a lot with particularly child welfare and judiciary issues. So.
Andrew Birchwood, Washington District.
And the other empty chair is our pro tem, Senator Gillard, who will probably be joining us later, but he's obviously multitasking. So, and you want to introduce yourself?
Yeah, I'm happy to. Thank you. I'm Ginger Irish. I'm the Director of Communications and Legislative Affairs for DEPA. So I'm
And
the
we put together that nice book that we use, and you asked me to offer any suggestions, and I don't, but I'm sure not every, out of 180 people, I'm not sure everybody's reading it, but it gives you all the information one could ever want. So, and you're,
Tracy O'Connell, Financial Director.
no, we know who you are. You're here to monitor, right? Fill in the gaps. Okay, all right, so let's go back and now we'll go back to your script here.
Okay, great. So what we've been doing so far in our testimony is just doing a quick overview of the ups downs document, talking about our logic as it relates to tying that all back into the narrative, but predominantly probably working off of the narrative because that's what the context is for the discussion we're going to have today. So for the ups downs document, we have our funding sources and uses across the top, general fund all the way on the left, working over to the investment global commitment fund on the right, and aggregating to a total all the way down the right-hand side. DEVA has 4 main appropriations. They are the B306, B307, B309, and B310. For internal purposes, we look at DEVA as one department, but 2 halves. We have our administrative side, which runs the day-to-day operations. Any costs incurred there are to facilitate the work that we do on a daily basis for our Medicaid members. That is the appropriation B306. And when I talk about the programmatic side, that is the actual Medicaid-driven component of the department. So that is the three other appropriations, B307, 309, and 310. So when I refer to administrative versus programmatic, that's the differentiator there. So that's basically how the ups downs works. It sums down in each one of those columns, and it also sums over to the total in the aggregate there. So it crosses those appropriations, and what we've done within the narrative is where there are increases or decreases that cross appropriations. We've tried to put those in tables for you to see each individual appropriation, the impact to it, and then aggregating to the full gross and state impact or state funded amount. So that's generally how we've put this narrative document together for purposes of review and this request here. As Andrea stated, our gross request is about $101.3 million. That is made up of almost $5.9 million on the administrative appropriation, and then the other 3 appropriations under the programmatic component are about $95.5 million, summing up to that 101.3. So moving into the administrative component of this and the $5.9 million request, it's made up of 3 items, and the first one being transitional housing complex care management. This is a backfill with general fund for the loss of federal funds that are going to be waning here for purposes of the Vermont Chronic Care Initiative being redeployed into the complex case management transitional housing under AHS. So that comes with a gross impact of 0, but a general fund impact of $200,000. Item number 2.
It's water?
Yeah, I had water,
Oh.
went down the wrong way. Thank you, though.
Item number 2 is the Agency of Digital Services Service Level Agreement. Departments and agencies around the state of Vermont all make use of ADS for purposes of IT needs. Everything brought to us here today, IT is thank you to the fine people at ADS, Agency of Digital Services. We do have an increased cost component here of about $64.7 thousand that we're requesting from you for purposes of that service level agreement. The next item up is the Medicaid Data Warehouse and Analytics Solution. This is an effort by the state that's underway to construct a centralized data repository with robust reporting and analysis tools. This will contain Medicaid-related claims and clinical data, and is the next step in the MMIS or Medicaid Management Information System modernization efforts. So,
Who else uses data other than DEVA?
I'm actually,
Central office?
it's a great question. There are Medicaid programs throughout each department in the agency, so everyone would be able to utilize this service. This is also, the purpose for this being in here today is to request the spending authority. It's a carry forward amount. So that's really what we're asking for. And the project itself has been underway since 2020. And it really was related to CMS guidance. And these are functional improvements that will happen over a period of time. It's not necessarily a thing at the end of it that you get, but more process improvements to make it easier for Vermonters, to make it easier for DEVA and other departments across the agency as well to analyze the data and make better decisions for the program.
And your MMIS contractor is
Gainwell, still Gainwell. Mhm.
I'm back where it was Ross Perot.
It's been a while.
No,
Is that
I don't know, that's what, huh?
Is that the representation of the match on it, or is it the 50 for the whole? Is it just that,
Typically, it's 90-10 match.
but because this is carry forward, it's the reason it looks like it's not 90-10. 38,
So I believe
3.8 data.
the reason for this amount is because we were not anticipating to have a public health emergency that lasted this long. And because, due to that, we received enhanced FMAP. And these are new funds over what we anticipated having. So that's why the reason for the carry forward.
So the total project cost for the warehouses?
I don't
It's in
have
the
the-
5.8, or is it got to be a
No,
higher
these
number?
are just the carry forward numbers.
Okay, so what is the federal match on this? Because it's 3.8 generating a gross of 5.8. That's, I think, part of the question. If it were 90-10, then you would see a much larger gross for the 3.8.
I believe it's 90-10, right, Tracy? Yeah.
And the DEVA is seeking additional federal spending authority in the 24 budget. So this is what the federal portion of what they anticipate to spend in 23.
But it's a 3.8 also carried forward in 24.
Yes, that's to put the money came from central office, the global commitment appropriation, but this is a way to transfer it in its entirety to DEVA to use in 23 and the out years.
So is it roughly a $38 million project? If
If
3.8 is the
it's a
state
90-10
match?
match, that's what it should
Well,
gross up to.
I think we'll have additional context for you in the FY24 presentation, but it's an ongoing project over more than just this.
We understand that. I think what you're trying to do is reserve the state match that'll be carried forward into future fiscal years, but at a 90-10 match, that 3.8 would generate at 90-10 a total of 38 million. That's what we're talking about. Tracy, you're nodding your head. You understand what
I
we're.
understand the question, yes, can I follow up?
But can I ask, so what are you saying when you have gross and state for each one of these things?
Oh, because the Medicaid program is matched, every state dollar is matched with federal, so, and there are different match rates, like, IT projects sometimes come in at a 90-10 match.
Right.
It used to be you get 90-10 on family planning. I don't know if that's still in place. So there are a host of different match rates. SCHIP, which is
Are you
Children's
saying the
healthcare.
gross is just the federal funds or something?
No, it's a
else?
total. The gross is, if you put in, but this is why we're raising the question. It's confusing because
Right.
that 3.8 is gonna end up in total over a period of time, more than 5.8 gross. So,
But like the transitional housing has no gross.
Right.
Number.
no,
That's just
Because there's no
replacement
federal
of federal.
yeah.
You see the red where it's.
yeah, it's just backfilling from the loss. So you will see that the state dollars will draw down, it's like transportation, that has an 80-20. It's just
Yeah.
Medicaid is more complicated because it's got
It's got base
more.
match,
it's
enhanced
got-
match,
Yeah, it's got.
agreed upon matches.
Yeah.
That's exactly right.
And we can spend more time on it, but that's why that section of the budget's assigned to me.
We
Well,
like
some of
that.
them, the gross is, the state funds is greater number than the gross numbers.
Yeah. Well, why don't we keep going and get to those, where you're talking about, not the next one, certainly. caseload and utilization.
I think you might have been looking at B309, but mostly. The state-only programs.
Oh, yeah, oh, that's a different. Because there's a global commitment and non-global commitment, and then there's state only, yes. So maybe, when we get. the
I'll get
book-
a tutorial in the
Yeah,
future.
yeah, okay, so let's go on to caseload
Yeah,
utilization, which is a really big number.
Okay, so we are transitioning into what we call the program or programmatic side of the department. That is the $95.5 million gross request. But you can see here with caseload and utilization related to public health emergency and continuous Medicaid coverage that is in place. Our request is just shy of $45 million in gross and just shy of $18 million in state. For those who don't know, the public health emergency, the enhanced FMAP, and the continuous Medicaid coverage have all been together as part of the kind of the package that has come with the PHE. The omnibus package that was passed a few weeks ago has begun to decouple the public health emergency from the continuous coverage requirement and then enhanced FMAP. But for purposes of the balance of 2023, which is why we're here, we have a request for $45 million to cover those previous assumptions that were made when the budget was passed last year and what our needs would be. But as the public health emergency has continued onward and it's been tied to that continuous coverage component, there's an enhanced need with Medicaid rolls continuing to be elevated for lack of redeterminations being started by the department. And for those of you who don't know what a redetermination is annually pre-pandemic Medicaid does income-based redeterminations to decide who stays on and who comes off the Medicaid rolls. And since the public health emergency, those have not been done. And if you wanted.
So how long has it been since we've done eligibility reviews?
March of 2020,
Yeah, 3 years.
Yeah, that's a long time.
yes.
Yeah.
Mhm.
We've seen a 22% growth rate over that period of time.
Although if someone calls and says, I'm reporting a change and it makes them ineligible, what action do you take?
There are very few exceptions to this. We don't take action unless they ask us to remove them.
Or if they say, I'm moving out of state?
Then we would have the ability to disenroll them, but it's very limited and we have not seen a reduction. We've seen an increase.
No, all we've seen is really over a 3-year period of time. That's right. All you're doing is accruing.
Correct.
That is correct. This is a good place to note too. You can see a table that we put in here where this has a cross appropriation impact. In 307, the global commitment is where the request is predominantly based. State only also has a $1.2 million impact, and then non-waiver is negative $25.2 thousand. So that aggregates into the nearly $45 million you see up at the beginning of this section of our 2023 request. Any further questions on the caseload piece? Before we move on?
No, what's your, and just through, with the change of the FMAP continuing, enhanced FMAP, and no determinations, it kind of resulted in the need to revisit some of that. Plus, you've got some utilization increases as well. So I don't, your PMPMs.
It's a challenge
Yes.
right now. And it will continue to be until we're a full year cycle through the redeterminations.
And we do have a report committee, we call it the 52 points of light. Well, maybe you don't anymore.
We do.
Oh, you still do.
We've kept your monitor. Yeah.
And that was developed back when Governor Snelling was in office, when the Medicaid program was just blowing up. And the disbursements per week were so significant. I mean, because it's such a huge program, we developed that. So we were tracking what those expenditures were week by week.
We get up into the high 20,000 range, to like 28,000.
You're talking about the TANF caseload.
Yeah, the TANF.
ANFC
Yeah,
caseload.
yeah.
it was just before welfare reform, it was over just a bit more than 28,000 recipients. It's now down about, what, 12 to 13, although it might be more because we've got a $7 million budget adjustment there as well, but yes. Yeah, I don't know what happened to all those reports. I gave them to Jackie Levine. Yes, that was very high, but those were families and children. So, all right. So this is just reflecting actual experience to date now that some of the assumptions that were used in building the budget have had to be revised. Other questions about this? Just hugely complicated. All right, now we're into buy-in.
Yes, Medicare buy-in caseload changes. This is the program that's been in place since the 60s to use Medicaid dollars to help buy in on behalf of dual eligible Medicaid beneficiaries. This is, it does vary a little bit year to year, but predominantly it doesn't move a whole lot. We do have a bit of an increased request here, largely based on some demographic changes. I'm sure all of you are aware of the challenges that face the healthcare system when it comes to Vermont's aging population. So we do have a request here to increase our budget based on some of the activity that we've seen in that space. Again, this is a cross appropriation request. Most of it resides in global commitment, about $1.1 million. The remainder of which is $157,000, which aggregates to the 1.289 million. Next up, we have the Graduate Medical Education Supplemental Payment. So what GME is, it's a postgraduate program that we contract with the University of Vermont, the Vermont Medical Center, to train physicians in their postgraduate residency program, help cover some of those costs. For several years now, it's been capped out at about $30 million. However, the methodology is allowing us to enhance up to $51 million. And so what we're asking for here is that net difference, the $21.2 million. We have what is a significant provider shortage in this state. The costs of providing care are also going up. And so the time to revisit the GME calculation was necessary, and we have the capacity here to enhance payments to the University of Vermont.
You're talking about the proposed funding mechanism does not require. You're talking about proposed or the existing one?
The existing one, but also in this proposal here, it does not require any additional general fund. So the money comes out of the University of Vermont, comes to the state, we match it up through the federal program and draw down.
And we also have some language that protects them if this ever goes away, then we've got to make up the general fund.
Well, that was investments.
Yeah.
That we've already taken care of. They've actually wound down.
Yeah, okay. Okay, so now we're to the retreat unless I have questions on GME. We'll keep moving to number 7.
So the next 7, 8, 9, and 10 are all related to the Brattleboro retreat. We have 4 separate line items here, but really 3 functional things that we're asking for. Number 1 is the alternative payment model year 2 appropriation shortfall. When the budget was built last year, there were some changes that have occurred that have caused the need for additional funding for that original APM year 2 request. So that's $3.6 million that we are requesting from you all to cover that original budget shortfall. So that's the first item. The second one is the Brattleboro Retreat Alternative Payment Model Year 2 amendment. There was kind of a dual need between the retreat and the state. The retreat could not sustain itself on the previous arrangement. The state has a critical need for inpatient beds that the Brattleboro Retreat can provide. And so in the fall, an agreement was executed to enhance the per diem rate and the Medicaid bed count, which is driving up the request that we have here. So one item of note is this agreement works on a calendar year basis, and we have all the fun of having to figure this out for a state fiscal year. So this agreement was retroactive to July 1st. So that being the start of our state fiscal year, there's a $9.384 million impact. And we had to project forward what that would be should things remain the same for the second half of our state fiscal year and the first half of their APM year 3. And that's
And
how,
then when
that's
you're
how
building your 24 budget, what are you doing?
we are carrying forward APM year 3 in the same manner. So you're going to see the exact same number. So that's how that agreement came to be and why it came to be, and the fiscal impact that comes with the agreement with the retreat for the APM year 2 event. The next 2 items are interrelated, but for purposes of transparency, we wanted to break them out for you. The Centers for Medicare and Medicaid have ordered phase down of these Institute for Mental Disease, or IMD, investment dollars. We have, as I understand it, an 8-year runway in which to do so. And therefore, this is year 1 of beginning to phase those dollars down. And so when looking at the ups downs documents, I've been pointing folks to Appropriation 309, and you'll see over on the right under the investment GC, you'll see the activity coming out of those funds in the form of $4.6 million and $4.9 million. And part 1 there is the $4.6 million is being brought over under the Medicaid Global Commitment Program. So it is a complete offset, 0 for 0.
So let me ask, it doesn't call, I know that we're phasing down, but what portion of those dollars are eligible under GC? Because
That's the phase down. They're not eligible anymore to draw the.
so that I'm a little confused about that. So what you're shifting, obviously they've got to be, a global commitment is under,
They're global commitment now, and they have to be taken out of global commitment, but we're not, it's a burden to the general fund in that, because.
yeah, it says from investment to GC funding.
To program, essentially, right?
Right. On top of page 4, Stephanie, it's what I'm quoting, right at the top. You're shifting a portion of these dollars from investment to GC.
That's the number 9, right?
Yeah. And I'm just saying, if they aren't eligible as an investment, why are they eligible under just regular waiver Medicaid GC?
So approximately 9 million DEVA had in its base budget to go to the Brattleboro retreat. About half of that is now eligible for program, and the other half has to be phased down to GF.
So what part's eligible?
About 4.5 million.
What sort of services?
Yeah.
Oh, what services?
Why do they qualify?
I'm sorry, Senator. Yes, it's for short-term stays under 60 days, and stays for the ages of 21 to 64. That's previously what we could not claim as program, that we got the SMI waiver, the serious mentally ill, serious mental illness waiver, that allowed us to transition to program.
Okay, that's what I'm asking. It was like, how'd you do that? All right, I'm glad you could, and that's,
And 10 is the piece that's going away.
yeah. Okay. A lot of moving pieces here.
Yes, there are.
Annual Medicaid adjustments.
Yes, next up are annual Medicaid rate adjustments. These become effective on January 1st, 2023. They are federally required for the federally qualified health centers, rural health clinics, and hospice services. It's $342.7 thousand gross. And it is again a cross appropriation impact of just under $337 for global commitment, and then $5,800 plus for the non-waiver appropriation. Next up, we have the performance year 2021 ACO settlement. So what this is the contractual risk arrangement that the state has with One Care Vermont, the accountable care organization. These dollars, once paid out to One Care, will be passed down to the risk-bearing entities, the community hospitals, that partake in their risk arrangements with the ACO. And this is the result of what would be called overperformance on behalf of the ACO as it related to an underspend
Well,
based
some of
on,
the editorials would suggest they're not seeing overperformance.
I'm talking contractually speaking here.
Well,
Yeah,
I understand that as just a comment. I'm sure there's been some question about what the outcomes and savings have been and how they're measured.
yes. So from that contractual perspective, they underspent, which would mean that they overperformed in that regard. And therefore, the state of Vermont within that agreement has an obligation to pay $7.18 million to the organization to be passed down to participating hospitals. This is largely a global commitment impact here in gross and a small portion of just under 100,000 in the non-waiver section.
So that is for
That was for 21.
21. So that's kind of, 22 might look different.
Yes,
Each year as you-
yep. And the last one here we have is state fiscal year 2022 carry forward, offsetting some of the caseload utilization discussion that we had earlier. $1.9 million in gross. These were funds that were set aside for the continued heightened caseload and utilization impact that we are experiencing. So it's providing a mitigating effect to our line item number 4 request. And that rounds out DEVA's 2023 budget adjustment request.
Questions? Probably when we have more time, and maybe Stephanie can help do this, we ought to maybe just have a primer on Medicaid. And what is really helpful is if we have the book, because I think that's a good document to give her the background information, because it's hard to remember what categories certain expenditures like disproportionate share payments to hospitals, how that's treated, what bucket, what's non-waiver, what is still match, what is state only. It's really hard to keep it all straight. And so I'm just thinking when we have a bit of time and we get into the big bill, it would be helpful to just have a sort of a summary like we did for the childcare.
Yeah,
And maybe that's something Stephanie
And Nolan probably has.
no one's got it great. Yeah,
Okay, so we can look at his slides and
Yeah,
look
that
at the
would be
book and
great.
see what
Yes,
the
I do
best
think-
process is.
because this is such a big part of the budget, and it's really enormously complicated, that as a committee, we could spend a little bit more time understanding how it works. But it's a funding stream that is used throughout much of the agency to support programs. And so we'll have some, Dale is coming in, right, on their budget adjustment. And so you'll see it, the whole Vermont's probably maximize Medicaid, federal dollars as much as any state, and so using those, that funding source through waivers. And that's what global commitment is all about. It's Vermont's waiver. And it's it's unusual because I've said, you see the appropriation twice through the secretary's office and then the department's budget. So don't feel you, Jenny, have had some familiarity obviously with health and welfare, but Andy, well, don't think you've got to understand it all in an afternoon because people have worked with it for a long time and it's still hard to keep it all straight. But the book that is put out really is very helpful because it really describes, the programs you can go in, you can see how much we're paying per provider type, for example. It's just a tremendous amount of information available.
Madam Chair, we're wrapping the budget book up this week. Ginger's been working really diligently on gathering all the information for the team, so we'll get that out to you hopefully by the end of this week.
That's great. And it might be helpful if, when Nolan comes in, who's our joint fiscal person who does a lot with healthcare. So questions about the budget
Yeah,
adjustment?
no, he has a couple of presentations that would be really helpful.
Any other questions while we have the DEPA folk here? All right, anything else we should ask you that we haven't thought of, Tracy?
No.
I've already. That's it.
The change at emergency board last week is not in these numbers yet, or they are in the utilization.
That's what I was wondering about that.
No, this is FY '23 BAA, so no, they're not in there.
The change was to FY 23. So,
They're not in these
they're not in this presentation,
correct
and they're not in the 52 points yet, but they will be soon.
for the budget piece. Is that that?
Yeah. Next.
Okay. So in this, on the big up, in terms of caseload and utilization, those revised higher utilization PMPM is in here or not in here
This reflects what we were in consensus at through October,
through October?
and then there's another
Iteration.
slight of increase coming in 3 of the line items in Medicaid, the central office, and 2 in FEMA as a result of the action taken at emergency board on.
So is that, the plan is to reflect those adjustments in the big bill?
We probably,
Or are you asking to have your budget adjustment
so
modified?
the language that came from the governor with his budget puts that in the C section of the big bill, but we could put it into the budget adjustment because it is FY 23.
I'm wondering if that's a better avenue, frankly.
It probably is just for
Do
tracking.
you like that one better?
I would love that.
You know, I just think it's.
Yeah, I think it was a timing issue, so.
It was,
yes.
it was,
Yeah, I can understand the timing, but now that
Yes.
we still haven't acted officially on the BAA, it seems to me we should have it reflect the most up-to-date information we have on 23. So I would certainly be open to doing that.
we may find that it comes from the House that way, I'm just not sure. Yeah.
All right, so that would be nice, but if not, we could still do it.
We can still do it. Because we do have the actual,
And we have,
Yeah.
great. Okay, then, other questions while we have. folks here? And I guess we're a little bit ahead. I'm gonna suggest we take a break and go off live